Having rounded shoulders and forward head carriage is normally caused by an imbalance of muscle strength and stiffness in the shoulders, cervical spine, and thoracic spine. This can cause a stress and strain in this area and lead you on to have arthritis in these areas and possibly loss of motor control and sensation down the upper body and into your limbs. That's because a lot of the nerves from your neck actually innervate the upper body. By doing the exercises to strengthen opposite direction of your daily routines, such as pulling your shoulders back and tucking your chin in to give you a semi-double chin, we'll be fighting countless of hours from hunching over at our desk, driving, and on our phones. The exercises in this video will help loosen up your back, strengthen your back up, strengthen the necessary muscles to give you a more upright posture, and prevent you from pain and stiffness in these areas such as your neck, shoulders, and thoracic spine. I do these exercises myself to help my sport of choice, Olympic weightlifting, and also maintain my upright posture and most importantly, prevent myself from injuries. I hope these exercises help you as much as they helped me and my patients.
Wall W's. With this exercise, just stand with your back against the wall. Raise your hands above your head and your elbows should be up almost 45 degrees. The arms should be slightly slanted downwards. This will create a W with your arms and your head. Try to have your thumbs back and touching the wall, externally rotating the shoulders, and then in a slow and controlled manner, bring your hands back down again, internally rotating your shoulders. Do this for 10 to 20 repetitions and for 3 to 4 sets. Have about 1 minute break between these sets. When you raise your arms up, try to squeeze your mid-upper back muscles like you're trying to squeeze a pen between your shoulder blades. This will ensure a better contraction of muscles between your shoulders. Try to keep your head and upper back and bum touching the wall. If you're having trouble being pressed against the wall, you can stand about half a foot or a foot away from the wall and lean against the wall instead. This will allow you to concentrate on the arm movement instead of pressing yourself against the wall, which is the main purpose of this exercise. I know your head will come off the wall sometimes when you move your arms, but try your best to keep the head as close as possible to the wall. This will help strengthen the deep neck muscles that are important to reduce forward head carriage that is related to degenerative change in the neck and slouching posture. Wall slides. Stand against a wall and lean your elbows and upper back, head and bum against it. If you find it's a bit hard to lean against the wall, stand about half a foot or a foot away from the wall and lean back against the wall. Now slide your arms up and down against the wall. Try to touch the wall at all times with your thumbnails, touching and sliding up the wall. Do this for 10 to 20 repetitions for 3 to 4 sets. Have about 1 minute break between these sets. Remember to keep the elbows and head touching the wall, or if you can't do that, try to have them close to the wall as much as possible. In this video, we are trying to activate the external rotators of the shoulders and the back muscles that will help pull the shoulders back and your arms in external rotation, such as the rhomboid muscles and the infraspinatus muscle in your shoulder blades, which are important to help us stay in an upright posture and fight against having rounded shoulders and slouched posture. These type of exercises are great for building mobility and conditioning to allow you to do movements behind the neck, such as behind the neck pull-ups, behind the neck shoulder presses, since the bar moves in this pathway behind the neck and back onto your shoulders. Something I noticed that really helped my athlete patients is the barbell positioning for the squat. Some of my athletes even reported back to me that their hip, knee, shoulder, wrist, and lower back pain subsided due to the increase of mobility and stability increase in their shoulders and back. So please do not underestimate these exercises. Prone W's. Lay on the floor with your arms in front of your body and raise your head up slightly so that you are focused on a spot on the floor slightly in front of you. However, don't over raise your head, as this will overactivate your traps and cause hypertonicity and stiffness in your neck. Now raise your arm up and try to squeeze the muscles between your shoulder blades so that your hand and elbows are almost behind your neck, or try to bring them behind your ear as you draw your hand back towards yourself. Try not to gather momentum and keep your lower body on the floor with no feet movement. Then, in a slow and controlled manner, whilst contracting the muscles in the upper back and shoulder blades, extend your arms out again without having them drop to the floor. Do this for 10 to 20 repetitions, have a break for 1 minute, and repeat the exercise 3 to 4 sets. In this exercise, we will be working on the rhomboids, external rotators of the shoulders, such as the infraspinatus, and slightly on the lower back muscles. These muscles are very important for your shoulder health, strength, and mobility, which are prerequisites for overhead movements such as shoulder press, handstands, and overhead barbell squats seen in Olympic weightlifting. But most importantly, it helps prevent you from injuries, increase your shoulder stability, and improve your upright posture by fighting against your internal rotators of your shoulders that create rounded shoulders and slouch posture. Why raises? Get a rolled up towel and place it on the floor where your forehead might be touching the floor. Now, with your arms in front and your forehead placed on the towel, lift your arms straight in front of you and your thumbs pointing upwards. As you raise your arms up, try to contract your rhomboids and your lower traps, which are the muscles in the lower mid-back, just under your shoulder blades. Make sure to lower your arms down in a slow and controlled manner and not drop them straight to the floor. Your hips and legs should not come off the floor. The eccentric phase of any exercise is one of the most important phases to build strength and motor control in any exercise. So try to take advantage of that in this exercise as well. This will help activate the lower traps much better than not pointing your thumbs up. This muscle is a highly neglected muscle compared to the upper trapezius muscle that many people tend to overactivate with daily routines such as sitting or tensing up during an exercise, which may promote forward head carriage or poor posture. A paper was published on the effects of lower trapezius strengthening exercises on pain, dysfunction, posture alignment in patients in the Journal of Medicine Science Monitor in March 2020. The results showed a lower trapezius strengthening exercise program is an effective method to reduce levels of neck dysfunction and improving the postural alignment, muscle thickness, and contraction rate of lower trapezius muscle. If you want to improve your postural alignment and reduce neck dysfunction that may be causing pain and stiffness, please do the exercises in this video. Supermans. Lay on the floor and place your forehead on a rolled up towel, and then place your hands with your fingers interlaced behind your head. Now, with your hips, legs, and feet on the floor, raise your elbows up and allow your chest and head to follow and go up as well. Then, in a slow and controlled manner, allow your body to go back down and your forehead resting back on the towel. Do this for 10 to 20 repetitions. Have a 1 minute break between the sets and then repeat it again for 3 to 4 sets. During this exercise, you should try to contract the muscles between your shoulder blades and the rotator cuff muscles that externally rotate your arms and bring your elbows up and back from the ground. Try to avoid over tensing up your upper trapezius muscles, which are the muscles in your lower neck and upper shoulders, or overcompensating and pressing your head back into your hands. This will only make your upper trapezius muscles more tighter and possibly make your neck sore, or worse, strain your neck and upper back.
Once again, thanks for watching. I really want you to join my Facebook group. I want to build a community there where we can talk all things health. Now, if you do have pressing questions and you can't wait for my answers, please join my Patreon. That way you'll be supporting me and this channel. I'll put the links in the description box below. Now, if you do have upper back pain and you found this video helpful, please check out my upper back pain video. That video will help improve your mobility in your upper back and also prevent the pain and stiffness in your upper back as well. If you do have a shoulder pain, please check out my recent video for shoulder pain. That video will definitely help you out, reduce the pain and stiffness in your shoulders, particularly around the rotator cuff. Now remember to support my channel, hit like, hit subscribe, comment below for any questions, and I'll see you guys in the next one.